Welcome everyone. This is episode 5 of Anatomy Basics and Chinese Medicine. Today we're talking about the hip. In our last episode, we talked about the shoulder, and because these two joints are very similar in structure, I naturally wanted to talk about the hip next. So if you remember from our shoulder video, the shoulder is a ball and socket joint. If you haven't seen that video, please check it out here. And the hip socket and the hip joint is a ball and socket joint as well, which means that it has flexion, extension, abduction, adduction, internal, external rotation, and circumduction capabilities. All ranges of motion are capable within that joint. And the difference between the hip and the shoulder socket is that the hip is a lot more stable. It is usually a deeper socket, unlike the shoulder. So when I talked about the shoulder, I mentioned there's a lot more issues with subluxations and dislocations because of the shallowness of the shape of the glenoid fossa, which is that lateral aspect of the scapula. In the hip socket, the three bones that comprise the hip socket are the ilium, the ischium, and the pubis. The ilium sits on top, the ischium is towards the bottom, and then the pubis is more towards the front. And each side of the pubic bone is connected to each other via a pubic symphysis, which is a cartilaginous joint. It doesn't have much movement, but in women, it does have certain mobility because we need to accommodate for the vaginal birth. In the back of the hip, the two ilium bones are connected via the sacrum, and so the sacrum connects the ilium bones via the sacroiliac joint. And that lateral aspect of the hip socket, is called the acetabulum. And the long bone that fits into the hip socket, which is our thigh bone, is called the femur. That's why we have a femoral artery, femoral nerve, right, in that femoral triangle in the inguinal crease. And so the head of the femur bone fits like a nice ball into this acetabulum hip socket. Now, on the anterior aspect of the hip, we have a very important attachment site called the ASIS, which is the anterior superior iliac spine. So you can place your hands on the bony pelvis right below your abdomen and feel for these bony landmarks yourself. Now, if you have a little bit more adipose tissue around your waist and the belly area, you might not be able to feel these structures with ease. But if these bony landmarks are protruding a bit, you can definitely palpate them. Palpation means touch. You can feel them with your own fingers. Right below that is an attachment site called the AIIS, which is the anterior inferior iliac spine. So that spine of the ilium that is protruding forward, which is directly below the ASIS. And on the posterior aspect, we have the equivalent of it, which is called the PSIS. So posterior superior iliac spine, which generally in people looks like those dimples in the soft flesh when we're looking at someone's lower back area and right at the sacrum area. And the top of that ilium bone is called the iliac crest. The hip socket is a fantastic structure, but there could be potential for hip dysplasia, which is where the bowl of the femur is not fitting properly and is being displaced, and that usually happens during our growing years, right, as a baby and toddlers are developing, due to improper positioning of the baby. That's why nowadays baby carriers are specifically designed to create like a letter M, for the baby's knees to be higher than their hips when you're carrying the baby close towards your body. There are other pathologies obviously related to the hips, which we can talk about more when we get to the muscle and tendinous classes and videos. But for now, I just wanted to bring your attention to the bony aspects of the pelvis and how this structure looks like from that anatomical perspective. Now, when we're talking about the Chinese meridians that are running through the hips, on the posterior aspect, we have, just like in the back and the spine, we have the urinary bladder channel running through the sacral segments, and then that urinary bladder channel deviates to run through the glute. There is a channel that connects to the urinary bladder through the point called gallbladder 30. So the urinary bladder channel connects to the gallbladder channel on the gluteal area, or at the gluteal area, and it is really level with the piriformis. So if someone has a piriformis syndrome or sciatica or something of that nature, which again, like I said, we'll mention more when we get into the muscle videos, that's a good point to use and to release, whether you're using acupressure or acupuncture. And then further down the posterior aspect of the hip, we continue with the urinary bladder channel. On the lateral aspect of the hip is the gallbladder channel, and on the anterior aspect we have the stomach channel, which is more anterolateral, and then we have more medial aspects of the hip, which correspond to our liver, kidney, and the spleen channels. So lots and lots of channels are there that could be used to address any issues locally with the hip, whether it's a muscular issue or if it's a bony or a joint issue. We can address it with the kidney meridians, we can address it with the liver meridians if it's the ligaments and tendons, and of course we can address more issues with the other channels as well, depending on the area of trouble. I hope this short video was educational for you, and as always, if you have any questions or you'd like more videos like this, please put it in the comments below. I'd love to share more with you, and as always, I'll see you next time.